All right, thank you everybody. Welcome to this session on the COVID-19 infodemic in the Pacific. This is a session of the larger conference, the Pacific Cyber Dialogue, but this one, like one other session during this conference, is going to be live streamed on YouTube. So if you do not catch us here, maybe you're catching us on YouTube later. I'm happy to be joined here by a couple of great panelists, Romitesh, Kant, and Leanne, Jorari. We're going to have a little conversation here about types of information that people are accessing online about the coronavirus pandemic. This is obviously a big topic this year as the pandemic has affected the Pacific in really a variety of ways, not only with the viral infection itself, but also just the information about the virus being spread around and people consuming it through social media platforms and other online media. One thing that I'd like to clarify at the start is that we're going to be talking about a few different research projects and outputs during this session. These were projects that were conducted separately by the Asia Foundation and are not reflective of the funding sources that we had for the rest of the conference. So these are other projects that we put together with similar themes and that we felt were relevant to share here, given the topics of conversation that we've had so far, especially this morning. So the first research product that I'd like to just mention to you all is a brand new report that we're just releasing today. It's called the Pacific COVID-19 Infodemic, Challenges and Opportunities in the Pacific's Response to an Online Information Crisis. This is a report that the Asia Foundation put together with support from a number of people all across the region, drawing on many hours of interviews that we did with people from government, from civil society, media sectors, technology, communities, development sector as well. You can see it on the Asia Foundation's website as of today in the publication section. We've also linked it from the conference website. The reason why we use the word infodemic to talk about this phenomenon rather than talking about fake news or misinformation or something else is that what we really see in the case of COVID is that the issue is not only that there is a lot of false information or harmful information on the internet, it's just that there is a huge amount of content. There's just a massive quantity of it, and it makes it hard for people to tell which content is true and which is false. And this is especially difficult for more technical topics or medical topics related to the virus and the pandemic. We also see that social media platforms are being used for a whole range of things. It's not only that people are sharing false information on social media, it's also that there's a lot of valuable and useful and personal information being shared, personal meaning about somebody's own experience that is helpful for others. Governments and civil society leaders all over the region are using social media platforms like Facebook or Twitter or other blogs and websites to provide people with information in new ways that weren't possible before. That said, there were a few more troubling things that we did see over the course of this research and that we'll highlight in the paper and maybe discuss a little bit more over the course of this conversation here. One is that the safeguards that would protect users online in a lot of other parts of the world are not necessarily present in the Pacific, whether due to absence of systems that might exist on social media platforms elsewhere or other types of laws and policies just may not exist in the Pacific. There's also capacity gaps within the local media ecosystem to do the fact-checking work or to counter falsehoods, although they are doing the best they can with the resources that they've got. And finally, the policies and strategies at the national level and regional level haven't always adapted or have not adapted at a consistent rate to the new kinds of challenges that we're seeing in the information space. So to discuss these things, we've brought a couple of really interesting and people who I really enjoy talking to, whether or not we're live streaming. Leanne Jorari from the Pacific Freedom Forum, as well as she's also a freelance writer and producer based in Port Moresby, and the communications manager for a Papua New Guinean NGO called Equal Playing Field. In her role as coordinator for Pacific Freedom Forum, she's involved in activities and dialogues all across the region, though. We also have Romitesh Kant, who's an independent researcher who recently completed his Master of Arts in Politics at the University of South Pacific in Fiji. He also has many other hats he wears. He's an honorary research associate at La Trobe University in Australia. And he is very experienced and knowledgeable as a researcher on politics in the Pacific, youth political activism, and especially impact of ICTs on politics in the region. He was actually the co-director of a documentary as well that looks at how Fijians and Fijian society at large are coping with the challenges and opportunities of living in an age of smart communication technologies. So since there's just the three of us here and we've got an hour to chat, I'm gonna ask Romit to be the first one up here. I know that he has a few slides to share. We're gonna try to make that work technically. And Romit will be talking about some of the research that we did together, including sharing an early look at some survey data that we collected in the region and that we'll be publishing with his help later at probably next month. So Romit, pass it over to you.
Thank you, Ben. So today I'll be presenting on some of the research that we've been working on with Asia Foundation, looking at mapping the misinformation that has been spreading in relation to COVID-19 on Facebook forums in Fiji. So basically, I was responsible for coordinating the collection of Facebook data, and Tabet Research was hired to do the perception study on information sources. Trying to share the video, the PowerPoint slide. Sorry, I'm a bit technically challenged here. Right, here we go. So basically, just a snapshot of COVID-19 in Fiji. I think our first case was identified on March 19th. And in total, we've had 34 cases and two deaths related to COVID. The two deaths were basically border quarantine cases. And Fiji has been without COVID community transmission for more than 200 days. And our last community transmission was on April 18th, 2020. The next slide is basically looking at the clusters. So the most recent cases of COVID have been all through reparation flights. And there have been some clusters around Suva, Lambasa, and Lautoka, which led to lockdowns in these particular areas where community transmission did take place. In terms of Fiji's digital landscape, so the research, Fiji, there are, as of January 2020, there are 586,000 internet users in Fiji. And internet penetration rate stands at around 66% of the population. And majority of the people in Fiji actually use internet through mobile-enabled internet accessibility, so using smartphones. And smartphone penetration rate is around 1.24 million, which is around, I think, 113%. So some people have dual phones where they access internet from. Facebook is the most predominant form of social media usage in Fiji, I think throughout the region as well. There's about 560,000 Facebook users. In comparison, if you compare that to Twitter, there's about 25,000 people in Fiji who use Twitter. So Asia Foundation hired Tabet Research to do a perception study, and I think there was about 500 people who were surveyed, and of which 90% of the people basically said that they were concerned about the threat of COVID in Fiji, and 75% were extremely concerned. 93% of the people believed that COVID-19 was real, whilst only 7% either believed it to be a hoax or were unsure about COVID-19. In terms of information sources, I think this is a general trend around the region where traditional media is still the main source of information for people. And radio and television and newspapers comprise a lot of that traditional media sources of information. 46% said that Facebook was their primary source of information in relation to COVID-19. And an extra 23% said that they used other forms of social media, basically Instagram and Twitter. In terms of satisfaction with information sources in relation to COVID-19, in Fiji, overwhelmingly, people trusted the information that came from traditional media. This is being radio, TV, newspapers. They trusted health workers. They also trusted the government. So overwhelming majority actually did that. In terms of social media, you can see 67% trusted the information on social media, whilst 24% were unsatisfied with the type of information that was being shared. In terms of trust and social, again, with satisfaction and trust, basically the data correlates that a lot of people, overwhelming majority basically trusted traditional sources and information that was coming out from government. And I think it is one thing to commend the government on the way they conducted themselves in terms of transmitting information, real-time information through Facebook live streaming, through press conferences, but also through social media quite a lot. And our health minister was pretty active on Twitter as well, basically giving out information in real time through his Twitter profile. In terms of social media usage through the perception study, 71% of people basically said that they used social media weekly or more often. And Facebook, not surprisingly, was the most popular form of social media platform that was being used. A lot of people also used messaging apps, Viber, WhatsApp, Facebook Messenger, and 73% basically said that they use it on a weekly basis or more often. In terms of misinformation on social media, 9 out of 10 people saw untrue information occasionally, while 23% saw information more frequently. And 7 out of 10 people who were surveyed basically said that on messaging apps, they received private messages which contained untrue information. When they were asked what actions did they take in terms of seeing untrue information on messaging or on Facebook social media platforms, 8 out of 10 people basically said that they chose to do nothing with regards to misinformation that was being spread. So what we did then was basically collect data on Facebook on what was the ecosystem of misinformation that was present in Fijian Facebook forums. And the question that we used a case study based approach. And what we did was very targeted searches using keywords such as coronavirus, COVID-19, 5G. And then we extracted this information into a Google form and documented how many likes, reactions, comments, and shares were being that people were discussing, and we then used it to tag. So we collected in total 184 Facebook posts from these 5 Facebook groups. Chat Fiji is the largest Facebook group in Fiji with about 250,000 members. And we collected around 123 posts from there. Then we also went through the Fiji Exposed forum, Fiji government page, Ministry of Health, and there was a Stop 5G page that was specifically created to stop the 5G, Fiji's moves towards 5G, which has subsequently changed its name to, I think it's called Fiji for Better and Prosperous Fiji now. But during COVID, it was called Stop 5G Fiji. And when we collected these Facebook posts, we actually tagged them for whether it was genuine content, whether the content was opinion-based. In terms of misinformation, was the misinformation local or was the misinformation from an international source? And whether it was a local fake news or international fake news. So we tried to differentiate between fake news and misinformation in a way that clearly categorized, tried to distinguish between what misinformation was and what fake news was. And one thing we realized was that fake news mostly was spread around the origins of fake news was mainly US. And these I'll discuss in the next slide. So international fake news and misinformation was basically linked to the conspiracy theory linking 5G technology to coronavirus. So there are some quotes on what people were basically saying. So I think the whole 5G conspiracy theory started prior to COVID-19, but since COVID-19, it has taken its own form, basically linking this whole idea that the radiation emitted through 5G sort of alters people's DNA or cells in some form, and then it makes them more vulnerable. They also started linking, a lot of stories were shared through right-wing news media based in the US, so Breitbart and other sources. And they shared links, and they basically started talking about how we need to stop 5G in Fiji because 5G is a conspiracy theory. It's a biological weapon designed. Some people said it's a biological weapon designed by China and linked it to Huawei, because Huawei has been unrolling 5G and trying to get into the region and other countries as well. So there was a controversy with the UK. So people shared those stories. And one aspect of localization, I mean, one thing we need to make clear is that localization of this 5G conspiracy theory did not become offline to a certain extent. So it was mainly restricted to the online sphere. But there were cases of dead birds, pigeons in Savu-Savu, and a lot of people started sharing that this is all linked to the Vodafone 4G, 5G towers in Savu-Savu, which led to the Ministry of Agriculture conducting an investigation and then saying that these deaths of the birds were caused by blunt trauma as opposed to radiation through cell towers. And another interesting aspect is that the more research I did on the 5G dead birds issue, there was a lot of misinformation in Belgium, in Netherlands, back in 2019 around dead birds being found and some linkage to radiation through cell towers. So people basically in Fiji caught on to this, and they started alluding to the fact that we need to stop Vodafone from advancing into 5G technology because of this radiation being caused. However, with the 5G conspiracy theory, it never went offline, as we saw in Australia and other countries where they started protesting, burning towers, and all that other stuff. The second source of misinformation that was being spread was this whole linkage between Bill Gates, George Soros, the Illuminati, and the Freemason. Basically, that coronavirus was a sort of a virus that was created by them, by Bill Gates, and Bill Gates would then invest in vaccination and then would make money out of it. And a lot of people also talked about linking Bill Gates to COVID-19 in the sense that it's a way to control world population. It's for the Illuminati to take over one world order. So there was some connections between evangelical Christianity and the end of the world kind of theories around this as well. It's a bit interesting because we're still trying to unpack this linkage of how evangelical Christianity from the US, and which we see ever more present in the region as well, and its linkage to, and I did some research on Tropical Cyclone Winston and how evangelical Christians actually interpreted the cyclone as a wrath of God, basically. It's an end of world, end of days kind of thing. So this was the second form of international fake news that sort of proliferated in social media. And a lot of people alluded to Bill Gates, COVID-19, Christianity. And then the last one was that coronavirus was a fabrication of, basically it was created in a lab in China, in Wuhan. And this whole Chinese conspiracy that, and I think it's all linked to the fact that the Chinese government was very secretive in the initial days around COVID-19. So, and there's a rising xenophobia in Fiji and the region generally as well, skepticism about China's interests. So it kind of took its own life in Fiji as well, that it's a Chinese virus, it's manufactured in a military lab in Wuhan, and somehow the virus got out and China is now trying to contain it. And it's a military biological weapon that China will utilize to kind of take over the world. So these were the three types of international misinformation that circulated on social media in Fiji. And it generated quite a lot of interesting conversations, interesting discussions, where people, these were not three standalone conspiracy theories. There was linkage between all three in some way. Fabrication of lab in China to 5G corona, China unrolling 5G in other countries using Huawei as a company to then spread this disease. And then we also found some sources of local misinformation that was spreading. The first one started in Feb of 2020, when the Fiji government was setting up isolation centers in hospitals around the country. And the Navua hospital, which is about 1 hour away from Suva, the capital, was being set up as a quarantine facility, as an isolation facility wards. And the opposition in Fiji basically started circulating change.com petition to stop the government. And one of the things that they claimed was that the coronavirus was airborne and it can be easily transmitted through the southeast trade winds, which solicited a very impassioned and very hard-worded response from the Minister of Health that the opposition should not indulge in misinformation. Basically, at that point in time, coronavirus was not airborne. Particles could be spread in very close proximity, but it was not really airborne. And the government told the opposition that it needs to be a bit more responsible in the way it tries to put its message across as well. The second sort of misinformation locally that was being spread was basically Lotoka was the first city in Fiji to go under lockdown, because that's where the first case and a few other cases, a cluster was established. So a lot of panic buying happened, and a lot of people were sharing stories about how supermarkets are running out of food stocks, how the lockdown, because of the lockdown, food stocks will not be allowed to enter the city, which was quite untrue as well. And the Fiji government, the Fiji police responded by charging about 8 people for spreading rumors on social media. Some charges were later dropped, but the two most prominent charges that were filed against was with Linda Tambuya, who's an opposition MP and opposition whip, very prominent on social media, and a doctor from the West who spread some misinformation in relation to the lockdown and basically causing some sort of panic. So the court case against Linda Tambuya has been dropped. The other court cases, I'm not sure the status of it, but they have been charged, and I think they're awaiting their trials. The third sort of misinformation that spread was basically around vilification of two patients, patient number 1 and patient number 9. So there were a lot of stories being spread. Patient number 1 was a flight attendant who basically caught the virus whilst transiting, whilst on a flight to San Francisco. And a lot of rumors started flying around that this patient willingly knew that he had coronavirus, was going around partying in Nandi and Lotoka and was very irresponsible. And patient number 9 was a Fijian citizen who was repatriated from India via Malaysia, if I'm correct. And he broke quarantine, left quarantine, and went to the other island on a local ship. So a lot of vilification started happening, and there was, because he was Muslim, there was Islamophobia. There were issues around why is Fiji government repatriating people from overseas. Fiji government is being irresponsible in getting these people in, knowing very well that they were in hotspots in India and in Malaysia. And basically, the government did not help the case as well, where the Prime Minister and the Minister of Health and the Police Commissioner went on during a public press conference calling them irresponsible. They were not good citizens because they broke certain protocols. The patient number 9 broke quarantine. Patient number 1 was being irresponsible because through patient number 1, I think there were about 3 clusters of COVID-19 that was detected. So social media went into overdrive. People started blaming them, started making vile accusations, spreading some sort of misinformation and rumors around this. And basically, patient number 1 and patient number 9 were questioned by the police. And I think the case has not been forwarded to DPP yet. They were going to be charged under the Public Health Act for willingly spreading the disease, I think. So that's our Asia Foundation research in a snapshot on how we are trying to map the sources of misinformation and fake news that has spread. And just to conclude, that spreading of misinformation is not new, but social media adds this layer of accessibility that was not afforded previously, and the internet facilitates spreading of misinformation. And I think what we saw is that in the Pacific, during the measles outbreak in Samoa, this whole anti-vaxxer movement from Australia and New Zealand and the United States utilized Instagram, Facebook, and Twitter to actually spread anti-vaxxer information and misinformation that vaccination is the reason why people are catching. And it actually did have a very huge impact in Samoa, where I think about 90 people died, and they chose not to be vaccinated against measles. So whilst the internet does provide immense opportunities, it does provide the affordability of spreading misinformation. What we haven't seen is how health experts and how government agencies are utilizing social media to actually counter this form of misinformation. And I think through the research, through the Tebet research, the perception study, one of the reasons we have not seen massive offline engagement with misinformation is that a lot of people still in the Pacific and in Fiji still trust traditional media and government sources of information. So thank you very much.
Thanks a lot, Romit. And on that note about trusting traditional media and traditional sources of information, I think that's a great segue into our next speaker here, who works in the media space, is a journalist herself, and can, I think, give us some good insights into how the media sector has been responding to this crisis and some of the challenges that they're facing. So yeah, with that, I'll turn it over to Leanne now.
Thank you, Benjamin and Romitesh. That was such an insightful presentation. Yeah, just I don't have a presentation per se in slides or anything like that, but just sharing sort of the experience that media in the Pacific and my other colleagues who are probably watching this would also, sort of agree with me that, I mean, the role of media is vital globally and, of course, in the region. So, basically when this pandemic happened, people were, like Romitesh said, they were looking at traditional media. They're trusting traditional media more because social media, the cons, I guess, of social media is because the misinformation, the fake news. So yeah, I mean, and specifically, I'm in the Pacific because we have such a diverse geographic and socio-cultural, political sort of environment, atmosphere. So each country has its own, unique challenges. But I think like the main things, and I'm going to sort of share the experience in steps of what happened. So yeah, basically the lack of knowledge and ignorance is natural that comes along with something so unknown like COVID-19, because I mean, before, let's say, before January, February, no one really knew what COVID-19 was. So in the role of the media, our journalists had to go and research it and had to, sort of find out who are the proper experts to, inform us about what's happening and what it means for our general public. And so, yeah, that was sort of the first step. The first thing that happened is just a general lack of knowledge about COVID-19, about the coronavirus. And once the information slowly started getting out there, whether it was through traditional media or whether it was, through, like Romitesh said, the misinformation that was being spread or the fake news, fear mongering sort of happened. People started panicking because we saw what was happening in Australia, in New Zealand, and other countries. So yeah, that's sort of that fear and that panic, sort of people going out and panic buying, it sort of spread around the country, around specifically in Port Moresby where I'm based. So yeah, it's just that was the next step. It was just the panic and the fear. And then that accelerated, but like wildfire due to social media. Facebook specifically, which is one of the biggest platform in Papua New Guinea that users use. So that sort of misinformation spread like wildfire because of social media. And, people that I'd meet would be saying, oh, we read this on Facebook, or, we saw this. And it's like, there wasn't sort of a, I guess, I don't know, for lack of a better words, there wasn't much sort of, I want to say, it just spread like wildfire. People didn't know whether it was right or wrong, whether, where it was coming from, where the information was coming from. So it was just sort of complete chaos back then in the first few weeks of COVID. And so when the first victim was announced here in Papua New Guinea, I think it was a woman. And yeah, when that happened and the first victim was, the first suspected case was announced, there was a sort of stigma and, around her. And there was sort of, the same thing as what happened with the first case in Fiji. There was just a lot of that spread like wildfire about her case and, what she was doing, who she was, hanging out with. So people went back to her profile, and it was, there was basically sort of a case of cyberbullying where they'd go back to her profile and see who she was hanging out with from years ago, photos on her profile. And yeah, basically cyberbullying, victim blaming, that kind of thing. And so it sort of also put her life at risk. I don't think she was based in Port Moresby. She was based in another province. So that's sort of what was happening. There was a stigma around that. And so possible COVID carriers, and this is very important, possible COVID carriers, or, they weren't being tested. They didn't want to come out for fear of that, them facing that sort of issue. And so, yeah, they weren't coming out for testing. They weren't, speaking up out of fear that the same thing would happen to them, that they'd be quarantined. So, I mean, because of all of this, and it was, chaos, like I said, the grassroots, the public started looking at traditional media to stay updated. And it's a credit to organizations, media outlets like MTV, who had sort of a live show. I think it was, and I'd have to find out, but I think it was every few hours or twice a day that have this live show of what's happening, press conferences with the government. And that is also credit to the government as well for setting up this press conferences just to let the people know what's happening. And yes, as a result of that, there was also the I guess, social media, the pro of social media was that members of parliament were using Facebook to reach out to to the public and just let them know, removing the middleman and let them know what's happening, the numbers, things like that. However, the issue or the con with that is that, our members of parliament, like our people, the members in our government, ministers, needed to be informed as well, because like I said earlier, we've never faced COVID before. It's a very, it's something that you need to really understand. And so there were times when even our members of parliament didn't know what it was, or they weren't I guess they weren't trying to find out what it was, and so that go and say something without I think without finding out from the experts, and then that also just led to misinformation, like I said. So yes, in one way, social media like Facebook was good because it removes the middleman of the media and communicates directly with the public. However, the people like the government and authorities needed to consult with the experts, which a lot of cases, sadly, it wasn't happening. So there was like a lack of communication between everyone, and that's when also the media came in. There was a lack of communication with the media to just get the message straight, just credible, accurate message out to the masses for them to understand what was happening. I mean, that was the biggest I've seen, especially in Papua New Guinea. That was sort of the steps of how it came down to where we are now. But yeah, I think it's just when the crisis gripped the entire world, people sought reliable information, and when misinformation or fake news is what's being shared, people would believe that over basically.
Thanks a lot, Leanne. I appreciate your points that you made about the difficulties that everybody is facing, really, just in the media sector or in government, or as individual citizens, in figuring out how to respond to this, who to talk to, where to draw expertise or answers to people's questions. And yeah, speaking of answers to people's questions, we are fine to move on to a Q&A period now. So if any of you who are listening would like to ask any questions of the panelists here, feel free to use the Zoom Q&A button. I see one question here, which I'll just read off before, and yeah, if anybody else, feel free to add questions as well. This is from Malika Sobi in Fiji. Leanne mentioned that there's the issue of cyberbullying in PNG. And she's wondering, was this also an issue with the COVID-19 cases in Fiji, especially with the first patient who was a Fiji Airlines crew member? I guess, Romit, you might be the one who could answer that.
It was, we noticed definitely, like Leanne mentioned, a lot of people went onto the Fiji Airways crew members' public profile, Facebook profile, and started taking screenshots of his whereabouts and started sharing stories about what he did. So there was a lot of cyberbullying of patient number one directly because he was active on social media. So people were taking screenshots of their social media, of his previous few days, what he was doing. It was also laden with a certain aspect of homophobia as well. And with patient number 9, there was, I don't think patient number 9 was on Facebook. His presence on Facebook was that big. It's just that there was a lot of cyberbullying was couched around irresponsibility, but also certain aspects of homophobia for patient number 1 and certain aspects of Islamophobia for patient number 9. And cyberbullying generally is, I think, a rising concern in the Pacific region. So people do not take responsibility or do not think twice before they post on social media. So, yeah.
Thanks, Romit. I'm actually going to ask my own question before we go back to other questions from the attendees here. We all know that there are a lot of crises that the Pacific faces on a pretty regular basis, and will continue to face going forward, especially as a result of climate change and natural disasters. Each of these, I think, as Romit alluded to with his research on Tropical Cyclone Winston, these also come with a lot of similar features to what we're seeing now, where there's a lot of uncertainty. People are worried and scared. Could you describe some of the differences? This is for both of you, Leanne and Romitesh. Some of the differences between a kind of a natural disaster caused crisis like that and what we're seeing this year with COVID-19. Maybe since Romit answered the last one, if Leanne could go first on this one.
Sure. I mean, I think with a natural disaster, I could say that there's, in both cases, they sort of have their fair share of misinformation. But I think with a natural disaster, it's just a specific, I guess, for example, the earthquakes that happened here in Papua New Guinea a couple of years back, it was just in the highlands. So people outside didn't really know what was happening. We would only see or read information from media or from word of mouth, like social media. So yeah, it's something that didn't affect us all. However, with COVID, it did affect us all, and everyone globally as well. We're all sort of facing this and all sort of panicking at the same time or fearful. So it was something that we all went through, and so, I mean, I'd say it was a larger scale, and it's something that I think, definitely something that I faced for the first time, and a lot of my media colleagues, as well, because this was a global pandemic. It wasn't, so I think that's, for me, that's the difference I see, with natural disasters. It affects that small certain group of people, whereas this global pandemic, so that, I guess, yeah, chaos in a global pandemic, it ensued, and it's sort of on the same level, I guess. So that, yeah, that's my experience, my understanding of it.
I agree, Jen, with Leanne, what she said. Usually with natural disasters, it's very geographically focused. So with social media, one thing we noticed during TC Winston was that people did not have, who were not really affected by the cyclone, could actually get a truer picture of what the scale of devastation was. And a lot of people in Fiji with Tropical Cyclone Winston actually rallied behind "We Are Stronger Than Winston" hashtag that took over Fiji social media. They mobilized for philanthropic work, distributing food, clothes, helping people, fundraise money for those affected. Whereas the pandemic in itself was very global, and it sort of did have an impact in the sense that the information that was coming around with the pandemic as well in the initial stages was not as clear, what it meant. And I think in our lifetime, we have not really gone through something like this in the region, even with the bird flu, swine flu in Southeast Asia, even with the Ebola crisis, we were not really facing the scale or the magnitude of, what was happening. So a lot of people didn't really understand what coronavirus was. And I think the misinformation sort of took a life of its own through online platforms. And basically people have a tendency to sit around in social gatherings in the region, share a bowl of kava or have a drink, and it just amplified in a way that we are actually still trying to grapple with how the information ought to be transmitted really. And I think the media also was not, it's not that the media wasn't prepared, it's just that the scale of the implication was like the scale was so vast. It wasn't just restricted to one country. It was global. So it just became something that people in the Pacific really had to adapt. And I think professionals had to adapt, the media had to adapt, and social media, given that it's open, it's accessible, people just utilize social media then to, pass on information, but also it just amplified some of the noises that are really in a very small minority, but it amplified it to a point where people just, took information without trying to figure out whether the information was correct or not.
Yeah, I think the point about adaptation is really appropriate here, because that's probably the thing that a lot of us who are listening are wondering about, is how do we learn from this and adapt? What can we do differently based on this experience that might serve us well in the future? I'm wondering if you have any thoughts on that, and also, if there aren't positive examples here that come to mind, maybe some negative impacts that might ripple on for several more years, for example, due to the economic impacts of COVID. What are the ways that this experience is going to affect us in terms of how Pacific people consume news and learn things online, or how media houses function? What are some of the longer term impacts here? And whichever one of you feels like you're more ready to jump in on that, feel free to go ahead. Just before
Romitesh jumps in, just to to answer the first point that you made there. I mean, definitely, it had to take a sort of global pandemic for the media to learn how to adapt. And I mean, like Romitesh said, it's very new to us. We in the Pacific, I mean, we weren't prepared for this. We don't, it's not something that they teach you, how to, report on global pandemics, of this scale. And I mean, if, the media in the developed countries or the West weren't prepared, then obviously the media in the Pacific, we weren't prepared either. But definitely, it's a case of adaptability and it's lessons learned that taking from this, and how to report it, I guess, as well. In everything that the sort of like a pyramid, I guess, of what it affected, like you said, in terms of the economy, in terms of a lot of livelihoods were lost because of this panic. A lot of jobs, a lot of definitely poverty here in Papua New Guinea. It just sort of went through extreme levels, especially. And so, like I said, it's sort of all connects to that. It all connects to that, and that's something that I think the Pacific media is learning how to report on that, learning how to basically learning how to adapt and report on those key issues that all connects to that pandemic.
Yeah, completely agree with what Leanne said. And I think this pandemic, especially for the region, has actually opened a new sort of relationship between government and the media as well, which is not antagonistic, which is like we are all in this together. And what role does the media actually play in transmitting the information in a way that people would understand what is going on? And I think it's a unique opportunity for governments to actually collaborate in a more constructive way with the media to actually find out, what can be done should the next pandemic hit, and the important role that the media does play, because the results are pretty clear from the surveys in PNG and from Fiji as well, is that people rely on traditional media. People trust journalists. People trust, government sources as well. And that how does this, and I think the important thing also is the freedom of information. To what extent is the government willing to divulge information that will help the media then to report that? And I think one thing, I remember seeing something about Vanuatu. As COVID-19 happened, the government passed I think it was a regulation that the media was not allowed to report certain things around COVID, which sort of is quite unhealthy in a way, where the government tries to stop you from doing your job in reporting facts, in reporting information in a way that people would be able to understand what to do and what not to do. We really did not face that too much in Fiji, but I think accessibility, and it opens a huge opportunity for governments to actually now engage the media in a way that can complement the work the government is doing in the region as a whole, I think.
All right, well, we're getting close to our time limit here, so I'm gonna ask, I think, just one more question, and we'll try to keep our responses a little bit brief, if that's all right. There is a question here. These are a little bit complicated questions, so I might need to simplify a little bit and pick just one of the points here. I think the questions are about kind of alluding to what Romit was just saying about government finding another way to work with the technology sector and also media to address the spread of misinformation and harmful content. Just in the last few minutes that we've got, could either of you pick maybe one example of something that you think is a positive example of government working with media or with technology companies to make a positive impact in addressing misinformation, and something that you'd like to just call out as a positive example here?
Well, I'll just start. I think one thing that is commendable with the Fiji government's approach was that all the press releases, all the conferences were live streamed on social media as well. The government utilized social media quite well to actually inform the people of what was happening. Memes were being sort of information sheets, like one-page information sheets were created as well. When the Suva lockdown, Lotoka lockdown happened, they did a map, that this is the lockdown area. So the government actually did utilize social media to actually benefit, information reaching out to the people. In terms of technology companies, it's very difficult. I think globally, dealing with Facebook in addressing fake news has been a challenge. And I think the US elections demonstrates that Facebook is not as willing as Twitter to actually counter misinformation and all that. And I think we are pretty lucky in the Pacific in the way that we don't have interest groups that would leverage sort of in a more strategic way to actually spread misinformation. I think misinformation is spread on a very individual level at this point in time. So it's easy to counter individual sort of misinformation that is being spread. And one thing we noticed from the Fiji data collection on Facebook was that when the 5G conspiracy theory was being spread, a lot of people actually went online and took out memes to actually say that, look, radiation from 5G does not affect people. It does not alter your cell, your molecular makeup or whatever. So people did take it upon themselves to then correct misinformation around 5G. So I think that's a good sign for us. I don't know if technology companies would be interested in addressing misinformation in the region, because I don't think profit-wise we do matter to them much. So it's something to wait and see, really. Yeah.
Sure. Leanne, did you want to take a stab at responding here or give any last thoughts before we wrap up? I think you're muted right now.
Not really. I mean, it took me a while to sort of answer that, which is why Romitesh went ahead, is because I honestly can't even think of, a time when, and I'm speaking on behalf of my government, an example like that. I mean, yes, credit to them with the press conferences and stuff like that. But I think one thing that one thing that I saw was lacking, and a lot of people saw that was lacking, was just the communication between the government and the experts. I mean, we don't have all the answers all the time. So just ask, I think there was a scientist that went up on Twitter and was talking about that, about how IMR wasn't, and the IMR is the authority here in Papua New Guinea that was, dealing with the tests, the COVID tests and stuff like that. So there was just a general lack of communication between the government and, for her, IMR, which that was a huge issue because, they're the experts. They know, they can put the people at ease with their answers. And, it's just, if with lack of knowledge, there's just an ignorance that, breeds throughout, and that's what happened. So yes, sorry, not a very positive example, but that was reality.
Well, on that note, I think we're gonna close out this session. I really appreciate each of you for joining today, Leanne and Romit. It was great to talk with you. I hope it was interesting for everybody else here on the stream as well. Like we mentioned a few times, this is an area that each of us as individuals and the organizations we represent are also working on separately, and hope to be figuring out some answers, or at least some interesting research findings over the next few months. I hope that those of you who are doing the same in your own organizations will also keep us up to date, let us know how things are going, because this is obviously a really important topic and something that is always changing. For example, we did not even get into the issue of vaccines on this call. So thank you again to everybody who joined. For those of you who are taking part in our virtual conference here, we're gonna have another session on online safety for vulnerable groups. That's gonna be starting at 1 p.m. Papua New Guinea time. You can come back to the same link, or it's also gonna be live streamed on YouTube as well. Hope to see you there. We're gonna have a great group of speakers from the Online Safety Commission in Fiji, the commissioner there, Ann Dunn, the E-Safety Commissioner's Office in Australia. We're gonna have the COO, Rebecca Razavi, and the Education Minister of Tonga, Honorable Siausi Sovaleni. It's gonna be moderated by Andrew Mongo, who a lot of you probably know. So I hope to see you there, and thanks again.